Good afternoon, everyone. This is Sarah Arkansas, your clinical pharmacist. Welcome to another episode of Medication Education News and Update. So, what is Ultomiris or ravulizumab? Ultomiris is from Alexion Pharmaceuticals, FDA approved in 2018. This medication is a complement inhibitor indicated for the treatment of adult patients with paroxysmal nocturnal hemoglobinuria, or PNH, for the treatment of adults with pediatric patients 1 month of age and older with atypical hemolytic uremic syndrome or AHUS to inhibit the complement mediated thrombotic microangiopathy. As I mentioned, it's a terminal complement inhibitor that specifically binds to the complement protein C5 with high affinity, therefore inhibiting its cleavage to C5a and C5b. Ultomiris inhibits the terminal complement mediated intravascular hemolysis in patients with PNH and complement mediated thrombotic microangiopathy in patients with AHUS. It comes in at 300 milligram per 30 ml in a single dose vial, also 300 milligram per 3 ml in a single dose vial, and lastly 1100 milligram per 11 ml in a single dose vial. The recommended dosing regimen in adult patients with PNH weighing 40 kg or greater consists of loading dose followed by a maintenance dose administered by IV infusion. Ultomiris weight-based dosing for PNH is for body weight 40 to 60 is loading dose of 2400 milligram, maintenance dose of 3000 milligram every 8 weeks. For 60 to less than 100 kilogram patients, loading dose of 2700, maintenance of 3300 every 8 weeks. For dosing for AHUS, it goes based on the weight again as well, and loading dose starting from 600 to 3000, and a maintenance dose of 300 to 3600 every 4 to 8 weeks. For more detailed information on the dosing, refer back to the package insert, which will go over more information on the dosing based on the patient's body weight and indication per indication for Ultomiris. Some of the common side effects seen from Ultomiris include diarrhea, nausea, vomiting, headache, pyrexia, and upper respiratory tract infections. Again, this is a summary information about Ultomiris from or ravulizumab from Alexion Pharmaceuticals, FDA approved in 2018, for patients with paroxysmal nocturnal hemoglobinuria or PNH, as well as patients with atypical hemolytic uremic syndrome. Refer back to the package insert again for cautions, precautions, side effects, and mechanism of action. Hope you enjoyed this video. As always, stay safe and take your medications.